Hello and welcome to Felixstowe TV here at the Gainsborough studio. I'm hoping to do a quick update on community health. On Tuesday the 19th of May, the Ipswich and East Suffolk Clinical Commissioning Group, they were the organisation that took over from NHS Suffolk, had its board meeting at Kesgrave. We were somewhat delayed, sadly, because of the inability to leave the A14 and join the ring road to get you to Kesgrave. We sat there, would you believe, for just under the hour. So we arrived a little late, but nevertheless we were there in time to find out that the community health organisation that will be probably taking over from the private provider Circle has been determined. Now looks to be a consortium of West Suffolk, and I'm not sure who that was. I'm assured that it's some NHS organisation, Ipswich Hospital, and the Norfolk Community NHS Trust, which was an organisation that provided the services, be it community hospitals, MIU, district nurses, all the sort of things that are right in the community that probably you have more contact with than you do district hospitals or acute hospitals. So to us it's very important. Now, it would appear that Circle, having bid very lowly to acquire the contract, nearly 4 years ago now, it was 140 million pounds to deliver all the community services that you and I enjoy, and we here in Felixstowe, despite losing an awful lot of community services that we did enjoy. You may recall, if you've been here some time, we had a wonderful consultation document called Changing for the Better. Nobody quite knew whether that should have been better or different or worse or whatever. But what it did mean was that the level and depth of community support that we actually had here in the town was markedly reduced. And then to add insult to injury, they had no choice apparently at the tendering stage but to accept the lowest tender, and apparently that was by a significant amount, and that was a company called Circle, S-E-R-C-O, and they have themselves, since actually winning that contract, they seem to have had all sorts of problems in all sorts of areas with regards to prisoners, tagging prisoners who'd perhaps been buried but were still being invoiced. Anyway, we won't go into all of that. Suffice to say that the profit that the company hoped to have made apparently is more like a £14 million loss rather than whatever their intended profit was. So it would appear they may have wished to acquire this particular contract to promote their health activities in the US of A rather than in the UK. Time will tell. So that was one of the key announcements made at the board meeting, and it was really just in the form of a 3-page update, agenda item number 10, if you're interested in going in online and seeing, and it actually was a 2-page report, really just a list of things that were out there. And what I've just told you actually isn't, it wasn't a written list, it was a verbal presentation to the board and its members. There were no reporters present there other than myself, so I think it will get to the newspapers at some point, I'm assured. I understand it's already been on Suffolk Radio, or Radio Suffolk, so that should keep you in the loop. Now, for those of you who've perhaps been monitoring Felixstowe TV over the last, 7 or 8 years now, I've done various interviews on this station with Chris and then with Giles and currently today with Ness. So we do try to keep you abreast of what is happening in health in our town. One thing we don't seem to be getting anymore is presentations from either Ipswich and East Suffolk Clinical Commissioning Group or the health body, we seem now to have fallen a bit into a backwater. So perhaps this is a nice little publication that I picked up at Kesgrave on Tuesday. It's called CCG News Engage. I suppose you could change that to engaged, as in your ability to get to your GP. And that was one of the questions that was put to the board at the end of the meeting, sort of about 12:30. The board allows 15 minutes for questions to be put on things arising from the actual items under discussion and the previous minutes. So I've been raising a question with them for some time. And the question really is this: knowing that the GP sort of demographic is such that there is a big bulge of GPs towards the retiring age, and apparently a difficulty in recruiting younger folk coming in at the bottom end, how did the board see a possibility of a delivery of 24/7 GP services everywhere, whenever you wanted? And I sort of thought, this sounds almost like Google. It's not related to the real world. To have that service, you require resources, and we know the resources are already stretched delivering the so-called office hour service that we currently enjoy. And we do have, do we not, the out-of-hours service that's provided. Granted, it is actually privatised effectively. I think it's now being delivered by Care UK, having been provided previous to that by Harmony. Because one of the problems with all of this, of course, is these organisations keep being swallowed up and merged and whatever, and the consistency just doesn't seem to be there, does it? Anyway, the reason for that, and you may have blinked some years ago when Dr. John Reid decided that he had to get a signature to GP contracts before the general election or whenever, and the deal was this: they said to GPs, well, if you would like no longer to be on call 24/7, so you could have weekends off, bank holidays off, your evenings off, we'll sign this deal, and if you're prepared to give us a proportion of your salary back, then we'll use that and we'll provide an out-of-hours service. And that's when the disconnect occurred between the GP and his patient. It was a very bad political decision that's sort of led us into this rather more fragmented service than the one perhaps we should rightfully expect. So, have a look at this. This is Ipswich and East Suffolk Clinical Commissioning Group. They receive the money, allocate the money, discuss where it should go. Their meetings are open to the public. You do have the opportunity to question them at the end of it. If you do have any interest in your families or your friends or your community health, I'd recommend attending to it. We'll try to get this added to the end of this little slot. And there you go. But the news is this: community, or the provision of community health, is returning to the NHS in the area that is covered by the Ipswich and East Suffolk Clinical Commissioning Group. So thank you for your time. Bye bye for now, and stay healthy.